I'm Hayden Wertz, and I did Toxoplasmosis. So Toxoplasmosis it's caused by a protozoa. It's an obligate intracellular parasite. It's called Toxoplasma gondii. It's the second leading cause of foodborne death, behind Salmonella and ahead of Listeria and norovirus. It's commonly referred to as toxo. It is one of 6 parasitic infections categorized by the CDC that they have decided to take action against. So others include Chagas disease, trichomoniasis, and cysticercosis, just to name a few. There are 3 main strains, type 1, 2, and 3. They don't really have a major difference between them. They all affect humans pretty much the same. There is some difference with how they affect mice. I don't believe 2 and 3 have as profound an effect. So Toxoplasma gondii, it infects nearly all warm-blooded animals. So this includes mammals, it includes birds, and it is capable of asexual reproduction in all warm-blooded animals, but it only sexually reproduces in the GI tracts of felids. So most often connected to house cats, but also things like lions and tigers. So it's an apicomplexan, which is a taxon of protozoa. Apicomplexans are all parasites. They're all disease-causing. Another notable one is the Plasmodium genus, which causes malaria. And toxoplasmosis, like most apicomplexans, is a very complex life cycle. So with the life cycle, it's best to start with oocysts. Oocysts are released by cat feces. They're shed by the epithelial lining of the cat gut. And if the cat picks the oocyst back up, it releases a bunch of sporozoites, which are what the oocysts are filled with. The sporozoites are the first main physical stage. They're non-motile, and they infect mostly epithelial cells in the gut. Once they're in the gut, if it's in a cat, they split into gametocytes and tachyzoites, and the gametocytes form new oocysts. That's the sexual reproduction. So if it's a person, an animal, anything else, the oocysts, they release the sporozoites, and the sporozoites differentiate into tachyzoites in the gut, and then they infect any cell they can get into. And this is where the disease happens, the actual disease occurs. And when the immune system successfully fights that infection off, they differentiate into bradyzoites, which infect they like to sit in the brain, the muscles, and the liver. And if meat containing the tissue cysts is what the bradyzoites form. If meat containing the tissue cysts is ingested by anything else, the cycle repeats, just as if the tissue cysts were an oocyst. So the bradyzoite stage, it's the latent stage. It's slowly reproducing. Think of it like viral shedding, only with a protozoa. So transmission, the big thing is tissue cysts in meat. So primarily pork, but just about anything else as well. The oocysts, they like to stick to fruits and vegetables. They can contaminate water, and they can sit in the environment for months, even years, if the conditions are just right. So the oocysts, they infect the litter, the fruit, the vegetables, the water. The tissue cysts, they are what infect the meat, and then the disease-causing stage, the tachyzoitic stage, that is what's actually responsible for infecting. They cross the placenta and infect the fetuses. And in rare cases, you can also contract the disease if there's an active tachyzoitic infection in a blood transfusion. But that's very rare, doesn't happen very often. And it's a very infectious disease, very successful. However, it's not transmitted person to person at all, so it's not contagious. according to the WHO, up to 50% of the global population has been infected. This is primarily in warmer climates, less developed areas, and up to 11% of the US population has been infected. And oddly enough, owning a cat is not considered a risk factor by itself. So, the disease itself, it's got little to no effect in most healthy, warm-blooded animals. It can cause, on rare occasion, flu-like symptoms. They're not usually a big deal unless they've been immunocompromised. In rare cases, ocular lesions, so uveitis, can occur in people. That's about 6% of non-congenital cases. The picture shows a ocular lesion in a person that's caused by a bradyzoite tissue cyst in the back of the eye. And this can, because it's the bradyzoite stage, it's the latent stage, it can recur and it will get worse over time. It's also shown in a cat. It's more visual on the exterior of a cat. We can see the inflammation in the eyelid. We can see the iris being torn. We can see cloudiness. Even rarer, it can produce skin lesions in non-congenital cases. This is called cutaneous toxoplasmosis. In non-congenital cases, it can look like a rash. It can look like chickenpox. In congenital cases, so in infants, it can often produce blueberry muffin syndrome, where the lesions are small, round, and blue, so the skin looks like a blueberry muffin. And all of these symptoms are more severe in the immunodeficient, so HIV and AIDS patients. It can cause seizures, spastic paralysis, and poor coordination, as well as more severe flu-like symptoms, so higher fever, nausea, fatigue, and it causes severe birth defects in humans. So hydrocephalus, microcephalus, 1 out of 4 congenital cases end in death, so miscarriage, stillbirth, spontaneous abortion. Blindness, so the uveitis, that's 6% in non-congenital cases, is 60 to 80% in congenital cases. And the hydrocephalus, microcephalus, that is often produces mental disability. So the exact method by which the infectious agent actually causes the disease is largely unknown. We know it occurs during the tachyzoitic stage because the tachyzoitic stage is the only motile stage and it infects every cell it can get to. But how exactly it interferes is unknown. So prevention: fully cook all your meat. Never eat a medium rare pork chop. If you like your steak medium rare, that's not hot enough. That's where you can prevent the tissue cysts. The tissue cysts can't survive the heat. You wash and peel your fruits and vegetables. The oocysts, they don't like to stick to things very well. Never drink unfiltered water. So after you go gardening, wash your hands. If you touch the soil at all, wash your hands. Wear gloves. Keep your litter box clean. Change it daily. The oocysts only are infectious for about a day. Only non-infectious for about a day after they've been released. They're not mature yet, so change it daily. You have a much less chance of actually contracting the disease. And when you do change your litter box, wear gloves. Cat litter is gross, so yeah. Keep your cats indoors. Feed them good, clean food. As far as vaccines go, there just isn't one for people. There's one for sheep, but that's not very helpful. Diagnosis: they do serologic testing. So they check for the IgG antibodies that are specific to Toxoplasmosis, Toxoplasma gondii. That just checks to see if you've ever been infected. If the woman is pregnant, if it's a pregnant woman, they test for IgM antibodies because that tells you when the infection occurred. If there are no IgM antibodies, the pregnant woman does not have to worry about birth defects because the birth defects only occur if the infection is a new infection during the pregnancy. because it's the tachyzoitic stage. It's the tachyzoites that are capable of crossing the placenta. So they also do cerebrospinal fluid smears and biopsy stains. On the slide is an image of a positive stain. So in the green are the actual toxoplasma. So the treatment, most people don't require any. It's not very severe. For those who do, they take pyrimethamine and sulfadiazine and a folic acid supplement because it targets the folic acid metabolism. It targets the tachyzoidic stage because the tachyzoidic stage rapidly reproduces. It rapidly replicates its DNA, and the folic acid metabolism is what is required for DNA production. So you can't replicate if you don't have any DNA. And the tachyzoites, the intracellular tachyzoites, are shown in the picture. It's in the lung cells of a dove. So you can see there are two, and they're surrounded by a special phosphoric vacuole inside that protects it from the phagolysosomes. So there are some reported interesting effects on behavior. So it definitely reduces predator aversion in rats. It kills the fear response to cat urine and actually provokes a sexual response. Something similar happens in chimpanzees and their fear of lions. There's a sort of carryover of this fatal attraction phenomenon, as it's called, in people. In adult men, especially, our aversion to cat urine is significantly reduced. It just suddenly doesn't smell as bad post-infection. And there is documented and consistent personality change with latent infection, but we're not sure what exactly the causal relationship is, if there is one. But men are seen to be more vigilant and on guard. Women are seen to be more kind-hearted and open, and both are seen to be more impulsive, more aggressive, and less egotistical. And finally, there is a potential relationship with schizophrenia. It's not 100% clear what that relationship is. It's known that schizophrenic patients are 2.5 times as likely to test positive for toxoplasmosis. It's unclear if there is a causal relationship at all. And if there is one, we wouldn't know why only some people get schizophrenia and as opposed to everyone. And that's it. So that's toxoplasmosis. Thank you for watching.